as mentioned, since thrombectomy has become standard of care, we have this human temporary ischemia model where we have ischemia, but we can reperfuse the brain. So that's really the basis for neuroprotective agents to work. And I think that's why there has been a renewed interest, because before the brain would die anyway, because we were not very good at recanalizing vessels. So neuroprotectants wouldn't help. So now that we are able to do that, there's been a lot of research going on. And I think, but that's a biased opinion because I'm involved in that trial, I think the ESCAPE-N1 and ESCAPE-Next trials are really interesting, or perhaps the most advanced trials in that area, where they looked at Nerinetide, which is a PSD95 inhibitor, and whether it, when used in addition to clot removal, endovascular clot removal, whether it improves outcome in acute ischemic stroke patients. And the fact, what they found was that in patients not receiving TPA, it did improve outcomes, and that's because there's an interaction between TPA and Nerinetide, where TPA breakdown products inactivate Nerinetide. So there's an interaction between those two drugs. So in patients who do not get TPA, Nerinetide was able to improve outcomes and also reduce infarct volumes. So that's kind of the biological correlation to that. And that those results are hopefully confirmed in an ongoing trial called ESCAPE-Next. And if that trial is positive, then I think we're very close to having the first neuroprotectant approved for humans in acute stroke, which would be awesome. But of course, Nerinetide is not the only component. There are others such as RNS60 and like lots of other promising cerebroprotectants that have been developed and are currently being tested in phase 2 and 2B trials. But I think Nerinetide is the only one in the phase 3 trial so far, if I'm not mistaken. So yeah, more exciting things to come for sure.